We're going to put him in an improper position, because if I leave him in this position, guess what? You guys can't see because his knees are there. Legs flat. This is the improper position. This is not the correct position, but for you guys to be able to see, I have to put him in this position. I start off by inspecting. I notice that Billy's abdomen is flat to slightly convex. He's not obese, he's not distended or protuberant. Okay? I don't know, again, I can't see, but I'm going to imagine. He doesn't have any piercings, his umbilicus is midline. Okay? There's no striae, there's no visible peristalsis. Let's see if Billy's kind of young and athletic, so he might. I don't see a pulsation. Sometimes you'll see a pulsation in young and athletic, slender people, not a concern. Those of you that are young and athletic and slender, when you go home tonight, you lay in your bed, you look down at your belly, and you see it go with your heartbeat. Don't panic. You don't have a AAA. You're just young and athletic. If you think you have a AAA, get out your stethoscope, listen to it with your bell. If you hear a swishing, I lied to you, you have a AAA. If you don't hear the swishing, it's not a AAA. Okay? So, abdominal aortic aneurysm. Right, I said that a few times. It's where your abdominal aorta, and that's okay, it's a long day. You got like a garden hose, your aorta is a garden hose, and all of a sudden like part of the garden hose is weak, so you get a ballooning of it, that's the aneurysm. And then when the blood flows through, instead of flowing through smoothly, it swirls around in there. And that's a bruit. The bruit.
Oh, I heard you say that.
Yeah, right, yeah. Like, okay, we've got some of these words. Okay, so I'm done with inspection. Next I do what? Auscultate. I'm not actually going to put it in my ears because you guys can hear what I hear anyways. Clean it with alcohol for 15 seconds. I wash my hand. I start on the right lower quadrant. And I listen for how long? 1 minute. And when you guys test out, you could do this, so save yourselves 4 minutes. 1 minute, 1 minute, 1 minute, 1 minute. You just saved yourself a bunch of time on your test out. Right? So now you can spend time doing other stuff. You get a abdominal assessment. So I just want to know. And I would hear 5 to 34 vowel sounds per second in each quadrant. Less than 5 would be hypoactive. More than 35 would be hyperactive. More than 35 with increased sound, like intensity, would be borogamy. Okay? You would give me a cause of each one of those. You know, not eating, too much eating, bleeding. Good. Okay. So I've auscultated, then I'm going to auscultate his AAA. Right there, is it? Right above the umbilicus. And listen. If I hear a bruit, that indicates turbulent blood flow. That's a AAA, abdominal aortic aneurysm. If you hear a AAA, then you have to palpate for a thrill. I would touch. And if the turbulent blood flow is so bad, I would actually be able to feel it with my fingers. That's concerning. That means the bruit is more than just an audible bruit. I can palpate it for a thrill. Can I be goofy with you? You're okay?
You're fine.
You're not going to sue me, right?
Not at all.
You touch, hey boy. You touch for a thrill. This is called a thrill. I'm going to touch for a thrill. What's up, Billy? What's your name? You guys get the joke?
Yeah.
You touch for a thrill. Ha ha ha. You don't, Billy thought it was funny.
It was funny.
Yeah, thanks. Claire, don't have any more of my chocolate. Okay, I've auscultated. Right, then I'm going to palpate. I start off with light palpation. 1/2 inch, and I do what we call parallel lines. It's like cutting grass. Not your abdomen. That's hard.
It's ticklish, yeah.
Okay, that's fair. It's parallel lines, 1/2 inch. It's like cutting the grass. Does that make sense? Parallel lines. And I go up until I hit his rib cage. And down to the symphysis pubis. And I'm keeping an eye on Billy's face to see if there's any distension or discomfort.
I ate a lot today, so.
Can't, guys. I'd only be able to feel if he ate a lot in which quadrant? Left upper, right? Where the stomach's located. And chances are I would not be able to feel it. He would have to eat really a lot of food. Light palpation's done, then I'm going to do deep palpation. You use the restroom?
Mm-hmm.
Okay, we asked them beforehand. I'm right-handed, so I use my left hand for pressure, use my right hand to palpate. 1 to 3 inches. Hurt?
It doesn't, it's just like, I ate a
you
lot.
weren't ready.
I'll be fine.
What did you have to eat? Oh, it's Dairy Queen.
Yeah.
I saw that. What did you get there?
I got like the 4 chicken tender meal and like a
Ooh.
hamburger.
Nice.
Yeah.
Tenders and hamburger. You have fries too?
Yeah, I did.
And the milkshake? God,
Yeah.
I wish I was that age again. I can't do that.
I shouldn't have though.
You're regretting it?
I just don't care when I eat. Yeah, I just get whatever.
Well, and when you're young and healthy, you can't. Alright, so that's deep, and I did parallel lines again. Do you guys see it? And then my left hand's pushing, my right hand's digging around. Yep. And then I'm going to check for rebound tenderness. When I push and I let go, He doesn't have any pain. I push, no pain, let go, no pain. Push, let go, no pain. Push, let go, no pain. Push, let go, no pain. Now this is what rebound tenderness will look like when I let go. Give me a little moment. Not Brad Pitt, are we? So try that. In addition, right? You'd be like, oh! No.
You said a little moan.
I know.
I want to be a nurse, not an actor, Tim.
That's the physical assessment part, not the history-related questions, not defining all the words. That's just the physical assessment. You guys good with that? Cool. All right.